Good afternoon and welcome to TechNation's Tools of the Trade live demo. Today, we'll learn more about the tool of the trade, the Cognosos Asset Management Platform, which is also featured in the April issue of TechNation magazine. Today, we're joined by Stephen Fabius, Customer Success at Cognosos, and he will be demonstrating how the Cognosos Asset Management Platform makes room-level accuracy combined with AI-powered location engines easier than ever for biomed and central sterile teams to optimize the management of mobile medical equipment. So we'd like to thank our sponsor, Cognosos. Cognosos utilizes the power AI, to transform tracking data into operational intelligence, redefining the value of location solutions. They help hospitals reduce costs, optimize clean room operations, and improve staff safety with their RTLS and staff duress solutions. Cognosos is able to quickly deploy a system with room-level accuracy without room-level equipment that excels in complex environments, producing value from day one. So for more information, please visit cognosos.com. Now, just a quick reminder to please join us for our HTM mixers. Now, our first mixer is being held at the Omni Interlochen Hotel in Denver, Colorado, and that's May the 15th and 16th. And then our second mixer is being held at the Hyatt Regency in Milwaukee, Wisconsin, and that's July the 31st and August the 1st. Now, our mixers are a slightly modified, smaller, shorter duration, and less crowded event, but still provides valuable continuing education, networking, and vendor engagement opportunities. So, for more information and registration details, please visit htmmixer.com. I'd also like to mention that we have a milestone to celebrate here at TechNation. We turn 15 this year, and who better to celebrate with than our readers? TechNation invites readers, old and new, to help celebrate its anniversary with 15 prizes and a monthly time capsule in the magazine. So for more information and your chance to win, please visit onetechnation.com/contest. Okay, today's webinar is eligible for one CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your one CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Okay, let's kick off today's demonstration by giving away a Swiss Force Meister multi-tool. So using the questions feature on your dashboard, let me know the answer to the following trivia question. April is National Pecan Month. Which state is the largest producer of pecans? I'll review the answer and our winner at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenter is Steve. So Steve, you may begin whenever you're ready.
Thank you so much for the introduction, and everyone, thank you all for your time and to see the Cognosos Asset Management demo. What we'll do here is just kind of give you a quick overview of the agenda, give you an overview of the dashboard, the alerts functionality, the location engine of it, the smart ordering where we can help build the rules for you, ProPAR, we'll dive more into what that is, periodic automatic replenishment of devices, reporting capabilities that we offer, as well as some of the rules and of course asset management in general. I'm going to switch over to our demo real quick here, so just switching modules. Okay, so the way that it works is once we have all the hardware deployed throughout your facility, we work to have it's a web-based application, so any desktop, laptop, tablet, smartphone that can get you to the internet will get you to the Cognosos application. We work with your IT team, so you have a simple Active Directory login. So however you log into your hospital, you would do a quick single sign-on application here. That brings you and you're logged in. Quick overview, as you're seeing here, is our overview dashboard. Within the application, let's say high level, you're a general hospital. If you have different buildings, clinics, You could have a parent to child association. So depending what you're trying to monitor, you can have high level view and drain down into a specific facility as necessary. As I mentioned, through your Active Directory, you're logged in. You have user specific privileges depending on what your role is. Are you an admin? Are you a tech? Are you a vendor? Within your user profile, you have the ability to set alert subscriptions, which we'll discuss. Subscriptions could be part level management, missing equipment, preventive maintenance, rental dues, and then you can receive those notifications via email or text, and those notifications can be sent depending on what time you like, if you work Monday through Friday, 9 to 5, or if you have a 24-hour kind of schedule. Over here as well, we are going to focus on the assets module of it. Cognosos does offer within that application, which has made RTLS a better solution than when it used to be of just table stakes asset tracking, is now with the same infrastructure, we can leverage the staff safety application, real-time environmental monitoring, where you're seeing the medication, refrigerators, freezers, room temperatures, relative humidity, and then future state hand hygiene compliance. So the modules now offer you larger table stakes of what RTLS can do. Kind of overview. I'll try and touch point as much as I can. There's a lot to see, and hopefully answer as many questions during the process as I can. But what you're seeing over here, overview, let's say, of your facility, is you have over 2,800 assets that are currently being monitored. Asset utilization we provide of that equipment, par levels, which we'll get into as well, active alerts, which could be PMs, missing equipment. We provide you asset operational statuses, as well as some top 5 missing counts in, excuse me, utilization. The way that utilization is created and works throughout the hospital is, once we receive the floor plans of the hospital, rooms are designated as your clean rooms, your soiled rooms, your biomeds, your patient rooms. If a piece of equipment is in a equipment room, a clean room, it's available and ready to use. If it's in a patient room, it's in an operational status, it's in use. If it's in a soiled room, it's in cleaning required. Maintenance rooms can be your clinical engineering rooms or any other areas you designate. Missing, we can create within the application rules for when equipment hits receiving docks, exit points, to make sure that you can recover those before it's lost. Out of circulation, same thing. If you have a certain area where things can be decommissioned or put out of service, based on where that piece of equipment hits, that's how we're able to provide you the status state. And that's also what drives utilization. Do you have that equipment being used? Is it sitting unused? So we'll provide you deeper analytics that RTLS didn't have before, where it was just kind of blue dot experience tracking down a hallway. And I'll try and go one module at a time. Within the alerts, you have multiple types of alerts, as I mentioned. You can have PM due alerts, rental due alerts. If you have alerts for, let's say we have instances where telemetry boxes are wrapped up in linen chutes, they hit a a soiled linen area, you can have an alert set to trigger an event if something hits a telemetry or soiled unit, areas like that. Within your alerting capabilities, if it is, let's say, an assets due, you have the quick ability to see where it is on the floor. You can do a quick acknowledge or clear the alert, as well as create a task if you're trying to do any kind of PMs. So if you clicked on a task and you created it for, let's say, a team member or something like that, you can say, here's my asset due for PM. What does it need to be due? You have a running list of any action items you wanted to do within the system. Once you have that member that completes the task, they can go ahead and highlight it, and you have that event list showing the what was done for that piece of equipment right here. Devin Lane went ahead and acknowledged that that PM was due for that equipment. So within the map views, kind of really the meat and potatoes, if we're focusing on, let's say, biomed. One of the great benefits that started with RTLS was that need for time safe searching for biomed to do their job. You're spending all your days looking for that piece of equipment. Now with the application here, map view, we have 3 ways where we can show it. We can show it in the table view, map view. So what we do is, when we're doing the deployment of the hospital, we digitize the floor plans of the hospital so you can easily see what you're looking at. As I mentioned, patient rooms will be color coded one area. Your clean rooms are easy to see in green. We can color code your rooms, soiled rooms red. Uh, there is also a split screen view where you have the ability to kind of see what's in a room prior to entering, as well as you can kind of see there's a status here of potentially an alert that needs to be done for a piece of equipment. So I'll kind of go back to the table view to start and kind of show you. So within the application, all of these fields are filterable. I do apologize, some of this is a demo, so some of the features are, I'm not able to click through them. But you have dynamic ways of searching for stuff. You have a field search here where you can just start typing in. Let's say that I wanted to search for a bladder scanner. The more you type, the more dynamic it is. So right now I'm choosing a bladder scanner. Here's all the bladder scanners within the hospital. You can see that this, when we're adding information, here would be, let's say your asset ID, this would reference a biomedical number. It's a bladder scanner. If you had a secondary ID number, something like that, you could add that to the asset name. So you could have multiple unique asset IDs to find that piece of equipment. As I mentioned, we upload the floor plans of the hospital, and then you can quickly see if you're looking for that bladder scanner. We have the ability to upload images of that piece of equipment. You can get the tag ID, any pertinent information we upload for you, manufacturer, model number, serial number, PM dates. You have quick battery life information as well, and you can see where that piece of equipment is on the floor. Also, one of the great things, as I mentioned, since this is a real-time locating system, within that mention where I said where you might have a piece of equipment that goes out an exit zone or something like that, being that it is real time within the clipboard functionality here, you have location history of every piece of equipment. So you can see where it was and where it ended up. So you can backtrack. Did we have a piece of equipment that left South Tower and hit the receiving dock? What patient was it on? There's a way to potentially recover that piece of equipment or kind of see where it was before it left your facility. Within some of the other applications here too, I'll go to ordering for time. And I apologize, I'll kind of go back up to the map view because there's multiple things you can do here. As I mentioned, as you're searching for different types of equipment, within the application, you can see where it is. It's in building A, it's in floor 2, it's in pediatrics, room 202. There is always shared equipment. Infusion pumps maybe belong to supply chain, where maybe a ventilator belongs to respiratory therapy. On the top here where you see assigned department, you have the ability to search just for your specific equipment. So respiratory therapy is only concerned about their piece of equipment. You can kind of drill down and just find maybe a specific asset that's for you. As you can see here in our demo, we put some names, Jessica, Dr. Bob, things like that. These would be dynamic searches where you could look for anything and be able to find that piece of equipment. Clicking over into our orderings tab, this is where we kind of provide that workflow and analytics and overview of what is being used with the piece of equipment. How many pieces of equipment are being tagged, what's available, what's operational, utilization analytics we could provide you all as well. The system allows you to flag equipment as rental, so then you know how much you're renting. You can create alerts, as I mentioned, for when when rental equipment needs to be sent back, so you can be proactive to return it before accumulating additional rental days, as well as if a piece of equipment hits a soiled room, you could flag it to say, hey, rental equipment hit my soiled room. That way you can recover it, clean it, give it back to the vendor, or at least put it back on another patient. Quick information here, you can kind of see what's being overused, underutilized, out of circulation. So we provide information, a lot of robust reporting to allow users to make those decisions. Am I using enough equipment? Where is my equipment? The missing analytics, what equipment am I losing? Hey, we're losing telemetry boxes through a chute. We keep losing wheelchairs through an exit point. Maybe we should purchase different wheelchairs. The system does, as I mentioned, provide notifications to allow you to take action to potentially recover a wheelchair or anything that left out a specific point within creating an alert window of immediately or delayed. Search analytics, Clinical engineering, of course, as I mentioned, was kind of where RTLS started. How long are you searching for a piece of equipment? Your time saved searching greatly decreases. Your cannot find list is almost zero now. It's, as I know, it's a shared responsibility of the entire institution to find equipment, even though it's biomed's maybe responsibility to PM it. So you can kind of see how long it's taking, information that you can get kind of set in search analytics. Within our ProPAR application, as I mentioned, PAR stands for periodic automatic replenishment. These are the areas where, let's say, you always need to have a certain amount of infusion pumps or any pieces of equipment readily available for a user. ED, maybe as an example, always needs 10 infusion pumps. Patient comes in, they're registered, that patient goes up to a floor, now they have 9 infusion pumps, and that process continues. Now ED is at 0 pumps. Where can they find pumps? How can they be notified in advance to ensure that those areas are not at a critical or below point, to ensure that you always have it readily available? This also kind of touches back into that utilization, underutilized, overutilized equipment. Do you have equipment that's sitting in a patient room there's no patient in the room? Can we work with processes? And that's kind of what Cognosos likes to do, and myself as a customer success team, is how do we improve your processes as well? Let's get that freed up equipment into an area that it can be readily used. Within the par level statuses, you can kind of see here, you're able to create specific areas that might need it, or a specific floor, or a specific department, or excuse me, or a specific room. Quick view here, let's say we have bladder scanners. There is currently 14 available in ICU. Our value is 10 we need, so we have 4 extra within the ICU. So this would be a quick area where we can go and recover 4. As I mentioned, these are filterable fields, so if you clicked on them, you can sort by what's within par to the top, or stocked out to the top. If you have a supply chain or kind of a main area where you can have an open dashboard where you can kind of always have this running, someone can always be readily available kind of taking action on this. As I mentioned as well, in your profile, you can receive alerts for par levels out of range via text or email. The alert dashboard, of course, will also provide you those par levels as necessary. Reports, there's a lot of reports based on kind of everything that I was just explaining. Let's say we wanted to do our PM reports. We upload the PM dates into the information. You would receive an alert that a PM is due. You can schedule the reports to be sent to you monthly. You can just go in at any time you like. Kind of here is a generic report. Here is us printing a PM due report for a specific time period. This can be easily exported or just kind of held on the laptop. As I mentioned, this is a web-based device, so you could have it on your phone, and you could just be walking the hospital, walking your clinics, recovering the pieces of equipment on a cart, or approaching them and doing the PM on spot. Kind of go into some of the other level reporting, so you can kind of see some of the availabilities of it. Par level management as well, what areas were under or over, how can we determine, do we have enough equipment in certain areas? As I mentioned, in that par level, you may need a specific area, a department, ICU, to have 50 infusion pumps at all time, but within the ICU's clean room, you might need 5 infusion pumps. So there's ways of creating multi-level PARs within a zone. Our rules creation is, we work to kind of build them out prior, but what it is those rules I was discussing. Is a patient room an operational status? Is a soiled room a room that needs to be set as cleaning required? How much is a piece of equipment used? Infusion pumps are usually utilized 100% of the time. A glucometer, not really. Crash cards, we really not using those 100% of the time. So we can help build a utilization factor to help be more realistic on how much a piece of equipment is being used. You can build these out so you can be specific, as I mentioned, for telemetry units, other workflows where you need to be notified of a piece of equipment reaching a certain status of maintenance. Let's say, all right, as I mentioned, rule name will be telemetry box hits soiled room, room type soiled, asset type telemetry transmitter. The status, we can either consider it missing or out of circulation. And then once we set this shrinkage state, it would create a window to notify you immediately or after a specific time period. Within the smart operations, as I mentioned, this is kind of just the showing of the par level dashboard saying, hey, I need to set my threshold for a specific room. As I mentioned with asset types, all right, I'm choosing my infusion pump. Building is your main building. The ED department, is it a specific room in the ED or just high level? And then from here, you can create your higher and lower. As I mentioned, this is a demo, but we can create additional fields for the stocked out and critically under. And then within the asset management field of it as well, um, sorry, I apologize for that. When we're doing the deployment on the beginning, we want to work with all hospitals and facilities to kind of see what is that piece of equipment or all the equipment that you're interested in tracking and monitoring. Highly mobile, small, high value, whatever it is. We here, as you can see, there's a feature that allows us to bulk upload all your information. So we'll work with you on providing you a spreadsheet. What is the asset name? What's the asset ID? So we upload all this information for you. If you wanted to create a piece of equipment on the fly, a ventilator comes in, asset name vent123, asset ID, you give it its biomed sticker, whatever serial number, as I mentioned, assigned department if it belongs to a shared department, supply chain, respiratory therapy, asset type, as I mentioned, and any additional information you want to add to it. Is it rented or owned? So now you're building out the equipment individually. And then, as I mentioned, this is a RTLS system. You have the tags that you would put on the pieces of equipment. And now you have all the information. You've tracking stuff, you're doing stuff, you need to replace the tag, you need to add a tag. Simple ease is right here. Within your asset management module, you just click your little link feature. All right, I want to link a piece of equipment. I'm linking my feeding pump to tag ID. A button lights up here and it's successful link. So it's an easy process of linking a tag. Same thing for removing a tag. I sending out a piece of equipment for repair, it's being decommissioned, it's a low battery tag. Simply unlink the tag from the application. I have another tag in my hand or I'm replacing batteries and I go ahead and just make that association, disassociation. We, with the Cognosis side, part of the customer success team, are always kind of monitoring battery life. There's a huge question always about batteries in RTLS. We're proactive monitoring it. We see the battery life levels here. We provide alerts so any on-site admins can be involved. And then as well, the Cognosis side is always aware and supporting to make sure that we support you as necessary. I think I may have gone pretty fast going through all the modules, realizing here. I've kind of shown everything. I guess what I can do is maybe just um, leave it up to some questions now if it's not too early to switch over to that.
I have some questions if you want to start on them.
Sure.
Yep. Okie dokie. The first question that's actually come in is, are PAR rooms tracked and updated automatically, or are my transport staff required to update the room counts when they deliver the equipment?
No, that's a great question. They are updated automatically. That's the benefit of the system. As a piece of equipment enters the room, the counts will increase. As those numbers change, the numbers will decrease. So there is no need to change the numbers in the system. The system automatically does it.
Okay. Um, so what do you think is the most important feature of your platform?
Wow, that's a great question. It's a hard question to answer. I would say ease of use. To be honest, I've been in RTLS for about 14 years now, and that process we're just kind of showing of linking and unlinking something, creating an asset, and just the map view of being able to track something real time. The time saved searching is probably the next thing I would say on top of that, but just ease of use of our application by far.
Okay, another question is here. Can you work with Centrac legacy locating equipment so that we can get a few more years out of our first foray into RTLS?
Interesting question. There's been questions about that in the past. It might be something offline to answer or kind of do more of a discovery because we do receive that question. I wouldn't know how to answer it without more details, but um, something we could maybe evaluate for sure for you all. There's pathways definitely.
Okay, well, I will encourage that attendee to email you at your address that's on the screen. So,
Please.
okay, another question is, can your tags emit audio to facilitate locating an asset?
These our tags currently do not have an audible sound to allow for that. We have had that request in the past. There is integration potentially within an audible system through the application, as well as stack lights for areas like that, let's say exit points, to make sure that we can recover that asset, but the tag itself does not blink or create an audible sound.
Okay, another audio question here. Do you have a way to set off a local audio visual alert at an exit when a tag passes through the exit doors?
Yes, that was similar to the kind of what I was fielding for the question before. We work through the integration part through our system, we create that geofence for something crossing that zone, and then how do we want that alert to be triggered? Is it through an audible event? Is it through a stack light to notify someone that, hey, you have something on your cart potentially that should not be at this point, to recover it before it gets disposed of? Because users usually are saying, hey, if I'm at my desk and I'm not looking at an email, how do I recover that equipment? And that's probably why they're looking for an immediate point of alert. So we can work on that, yes.
Perfect. Now, can you also track staff? Any interfaces with Hill-Rom nurse call systems using your staff locating?
We currently do staff duress application where we can track the staff. So with a simple same infrastructure, you pass a badge out to your staff. In case of assistance or duress, they can simply push the button, and then from there it routes to security or dispatch to help them. It's not like the Hillrom process where it's a nurse call deactivation that is in future roadmap for Cognosis on how we incorporate it. But we do a staff assist, so I'd be more cautious to keep it on that. But whomever's maybe asking that question, definitely a follow-up we can maybe have on how we can assist.
That's the same attendee who asked the previous question, so I'm sure he'll be in contact with you.
Please do.
Okay, Stephen, before we wrap up, is there any kind of top tips you want to give everybody?
Well, this demo can be offered at any time. So if you have any other colleagues or anyone else that may be interested in learning more about the Cognosis application, please feel free to reach out to us. The application is very intuitive in the AI, so we do offer pilots and opportunities to kind of showcase in your facility. So when you're trying to maybe do discovery, always maybe keep Cognosis in your mind as an opportunity, and we'll definitely showcase what we can do for you all.
Perfect. Okie dokie. So thank you, Steve, for your time today and for a really informative demo. Thank you. I'd like to encourage everyone to visit today's sponsor's website, cognosis.com, to find out more about their products. As promised, the answer to today's trivia question is Georgia. So congratulations to our winner, Denton Anderson in Pennsylvania. Now, just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Now, if you've missed any of our past tools of the trade demos, including any by Cognosis, please visit webinarwednesday.live to view our whole archive. We'll be back soon with another Tools of the Trade live demo, so please visit webinarwednesday.live for more details and, of course, complimentary registration. Thank you once again for your time today, and I hope you all enjoyed the rest of your day.
Thank you.